Well, hello, everybody, and welcome to this episode of HCTalk. As always, I'm your host, Lance Gormley. Our guest on the program today is Todd Tangeman, who is the COO of NMC Health. How are you doing today, Todd?
I'm doing pretty good. Thank you. Yeah.
Thank you for coming out on the program.
Well,
Really appreciate you coming out here and representing NMC Health, and we'll get into it in the program, but I definitely have had past experience with NMC and have always left satisfied and taken care of. And I mean, I could even tell you some stories,
right.
but I've always, you all have always been a go-to for me, for my kids. I've mentioned that before on the program and whatnot, but really interested in talking to you, getting to learn who you are, what role you play, and why, and the whole thing. So,
okay. Well, thanks for the invite to be here, and glad to hear that we've been able to serve you and meet your needs, right?
Yeah.
I'll relay that to the team when I go back.
And surely somebody somewhere along the way might watch this interview and hear it. So that's cool. Okay, so how I always start the program with is, we want to get a little bit of a bio about who you are, where you hail from, maybe where you went to school, if you played sports, if you didn't play sports. So just were you born in Newton, Kansas, America, and been here your whole life, or where did you start out, Todd?
So the story goes way back to, so I was born in Denver.
Okay.
And then when I was 5, we moved to Cheyenne. And when I was in 6th grade, we moved out to the Pacific Northwest, a Vancouver, Portland area. And so finished out my high school there, went to a junior college out there. Wasn't quite sure what I wanted to do. I knew in high school I was in band, so music was kind of a thing. So I started out as a music major. And I quickly realized maybe in the second year of that, I'm not catching on to this stuff like other students. So maybe I need to do something different. So I actually identified another area of focus, which was public relations, mass communications.
Okay.
So I went to a private school in Indiana, Anderson College at the time, finished out my bachelor's there, and then went to D.C., worked for a while there after college, found my way back to the Pacific Northwest, and eventually discovered and found that I liked human resources. And so I chose that as a career area. I worked in human resources in several different industries. One was telecom, one was manufacturing, and then one was in technology. And finally, in 2001, was able to get into healthcare with Providence Health System, which is a Northwest regional system out there. So my family and I moved to Newton in 2006.
Okay.
And specifically to come to NMC Health, they had a position open, HR director, which is what I did at the time. And so that's what brought me here, and we've been here ever since. And started out in that role. Steve Kelly was the CEO at the time, so he was the one that hired me, and we came here with that. Since 2006, I've had Steve and both Val Gleason have given me some other opportunities, so the role has grown beyond HR director, so now it's COO, which is supporting most of the non-clinical areas, aside from accounting and finance that our CFO would be overseeing. So,
Well, I got a question. I'm interested. You talked about being part of the western half of the United States, and then being in a role there in your professional life. What was it like when you were looking for an opportunity to move up or change locations, and you came to Newton, Kansas? What was your first thought?
So that's right. Well, people ask, why did you leave the Northwest? Because it's beautiful, and it is. Part of this is, and it's a longer story, and sometime over coffee I'll tell you the rest of it. But the gist of it is, if you'll let me rabbit trail for a minute.
Oh, have at it.
When I was growing up in Denver and Cheyenne, we would visit my grandparents. So the family roots are in north central Nebraska. And my grandparents lived on a farm, and we would visit there in the summertime, maybe only for 10 days, 2 weeks. But when I think back on my childhood summer memories, that's all I remember. So it made a big impact. And so when we moved out to the Northwest, it was too far away to go for summer visits. But so I always said, someday I want to live in a small town in the Midwest, trying to relive those childhood experiences on a farm outside of a small town in Nebraska. So that's why I went to school in Indiana, Midwest, right? And that's what brought us back to Kansas, is still pursuing that. I want to live in a small town in the Midwest. At the time, we had 3 kids who were school age. It'd be great. And through a series of events, some I'll even call God things, things fell into place, and the opportunities were there that the opportunity at Newton came along. And so it worked out. And so we came willingly, and we've enjoyed it ever since. I love the Midwest. It's flat.
Yeah.
This area is very much like the area where my grandparents' farm was. So it's like, living the dream.
And then for people that don't know, Kansas does have beautiful scenery.
We do.
We have beautiful sunsets. If it's flat, you can watch that sun go down overnight. And it's just, I personally agree with you on the fact that we live in an area that's a wonderful place to raise kids. It's that small town, but it's not, Newton in particular is not a small town. It's a small city at this point. But when moving your entire family, was everybody on board with that?
Well, they were. Part of it was I have a cousin who lives in the area that we would have visited before moving here. So we became familiar with it. So it wasn't completely strange. So the transition was good. People were, we're going to go live where cousin so-so lives.
Yeah, very cool. Okay, so you come to NMC. At that time, it was Newton Medical Center. Mm-hmm. And we all know Steve Kelly. I truly appreciate the man and everything that he stands for and all the accomplishments along the way, especially with growing Newton Medical Center. Val Gleason as well, another name that you mentioned. I find both of those people to be very good, kind people that really have the community at the center of their heart and what they're doing. Right. And we can't go wrong with them, right?
Exactly.
And they are your supervisors. I mean, right. I don't know. Anywho, okay, so from coming to Newton Medical Center at the time to today, what did Newton Medical Center look like then?
Right. So when I came, it was primarily the hospital, and since coming here, they had begun to branch out and to expand services into specialty care, and to acquire practices, primary care outside of the Newton area. So, Valley Center, Park City, Heston, expanding kind of the reach of care, if you will. So those were new areas. Check my notes here. Those would be some of the areas that I think that I've experienced since coming in 2006. Yeah. So just an expansion of our service growth. Yeah.
And then you were on the ground floor for that, basically. I mean, as NMC, I mean, we're talking 20 years ago you came here.
Right.
I'm trying to place that and think, we would be the standard rural hospital, if you want to call it that. And then from when you stepped foot, what did you know that was the vision at that point in time, was to be able to grow the care of this rural hospital into other areas? Or was that something that just kind of evolved after you came?
A little bit of both. So there was always a vision for that. The specifics, I say, would probably have been evolved after I got here. So yeah.
And there's some new things. So just fresh in your memory, I know there's some things that have really taken place over the last few years. We'll probably get into that later too. But even now, that growth and expansion hasn't stopped.
Right.
I mean, what are some of the most recent things that you would consider big wins that NMC Health now is endeavoring to achieve?
Right. One of them that comes to mind is, we opened up a wound center a few years after I started here, and that really was an effort or a focus of Val Gleason's. She saw the need, and it's maybe a condition that is quiet or silent, right? So folks may have a festering wound that just is difficult to heal, even with the best attempts by their physician. And so what is needed is the specialty care that comes with a wound center. And so Val saw that and led us into developing and building a wound center with a hyperbaric chamber, which is a key element for the care. And we've been able to help a lot of people resolve some of these wounds that would otherwise end up with an amputation or other significant negative outcome. So that was a great win. Also, shortly after I came, we began construction on the 3-story surgery center. Mm-hmm. And so The first floor of that is outpatient surgery, and so we've expanded care there. The second floor really is where we have some of our specialty clinics, and so that would be our orthopedic surgery and sports medicine clinic is there. Our neurology clinic is there. We've had some other specialties that are up there. So those, we've expanded that. I'll say that. A couple of years ago, we enhanced our infusion center. So folks may come in on an outpatient basis for infusion care. And so we created a special space for that just off our main hallway inside the building. So that was an addition. Trying to think, Alice, I think I mentioned before, the expansion of primary care outside of Newton in some of our neighboring communities to provide care there. So those would be some things that come to mind. What else? We continually reinvest. So, a few years ago, it was time to get a new MRI, right? At home, the refrigerator goes out.
Yes.
Well, in hospitals, sometimes the MRI ages out, so you got to get a new one. And then same thing with our CT scanner. So we're always reinvesting in some of the equipment and the tools that we use to care. Right now, you're probably aware, so we're expanding our emergency department.
Yes.
And that is for a specific need. It's not just more space, but we have found in recent years that there is a greater need. There is a greater number of patients that have behavioral health needs, and the appropriate care for folks like that is especially designed rooms. And so that is a primary element of this expansion: is 3 additional rooms designed for behavioral health care in particular. However, those rooms can be used for care for any condition, but it'll help us to better serve our community and the folks based on the need that they have.
Yeah. So. That's forward thinking. I'll say that. I really, this is my opinion. I think as a society, we're starting to really grapple. I mean, I would say there was an awareness before, but now we're beginning to grapple with those and people that are in need in that way. And just knowing that you all are on the forefront of that. You see that coming in the future. You see that becoming a need that has to be met, and then to make the changes necessary to be able to meet that need is once again showing that NMC Health is leading the way. And I'll even say, we were talking before the program that I'm a huge fan of NMC Health. I really appreciate you coming on the program. My family, myself, has used NMC Health avidly. All 3 of my children have been born at the birthing center. Every time we've gone in there, there's a big gap between kids. I mean, I have a 17, a 14, and a 2.5-year-old. So over time, that's a few years. Even if the individuals that worked in there have changed hands, the culture has not changed. So the culture is very positive. I've recommended to numerous people to use the birthing center there. You didn't mention that, but I will say that I've had top-notch care every time I've gone in there, and just very appreciative of that. Plus, I had the benefit of using the old CT scan and the new one, and I really, really like the new one.
Okay, you got to test drive it, huh? Way to go.
Well, the old one was more like a coffin. You get in there, and then the new one, they've come along with technology. And for me, that was something. Just my own personal situation, and having used NMC Health for these years, I've watched it grow and evolve over time. And what you're saying are some huge, impactful things. And there was a plethora that you just went through. I mean,
and there's more. But you mentioned, let me just piggyback on your comment about the birth center, family birth center. We have a great core of physicians who provide obstetric care, and not employed by us, but they practice at NMC Health. And our birth center, I think on average, we do we bring well over 500 babies into the world. And the reputation is such that we have families and mothers who come to NMC Health for birth care from 21 different counties. And in fact, just in the past 6 months, I became aware of a family who lives in one of the western states, far, far away, but who was aware and familiar with NMC Health and our family birth center, and they've chosen to have their birth here. And that was in January, had a healthy birth. But I'm just saying the reputation is far and wide for the care that those providers deliver here at NMC Health. So we're pleased with that.
Well, you got to nurture that, right?
Exactly.
I mean, that's a great thing. Okay, so I know we mentioned quite a few things there, but I got to be more specific and ask, what do you think is the best thing about NMC Health?
So a couple of things come to mind. One of them is we're local, and we view ourselves as that local partner, I guess that's the right word. Local partner, investor in the community, friend. We know that a lot of the times the folks that we care for are friends and neighbors, and so there's that sense of community, really. And another thing that comes to mind, when we have new employees start, and we typically have an orientation maybe every couple of weeks or a couple times a month, and Val Gleason meets that group of new employees, and the question always is, hey, so why do you choose NMC Health? You can work anywhere, so why would you choose here? And frequently, one of the themes is we will hear many times, well, I was a patient here and really appreciated the care that I got, and I wanted to be a part of that. Or they may say, we had a family member who was here, and so I was here as a family member of a patient, and I saw what was happening and how the care was being delivered, and I wanted to be a part of that. And so that's an element, that's an example or a demonstration of what is happening at NMC Health and what sets us apart. I think, the term culture, that's thrown around quite a bit.
Yeah, that's
but really,
a cliche, but I believe in what you're saying.
But the sense is, who are we? And really, it's a collection of folks who, I think for the most part, understand that they have something to contribute, that they're living out their purpose or their calling for what they're gifted at, and view that as why they're a part of NMC Health and have that shared experience with coworkers. So I think those are some of the things, right? So it's lived out when you have people from 21 counties come to get care.
Right.
So anyway, those are some of the things that stand out, would make us a little different.
Okay, so I didn't mean to interrupt you. Okay, so I always ask the flip side. Anybody that watches the program knows I always ask for what's the best and what's the worst, and it's not the worst but the best. I always frame it as a challenge. Mm-hmm. In your opinion, what do you think is a big challenge, or maybe even a number one challenge that NMC has to look at going forward as a rural hospital?
Yeah. So like many hospitals, urban or rural, some of the challenges today are around, financial or reimbursement. So we recognize there's maybe a little over half of the patients that we serve, their care is paid by a federal or a state program of some type, and there are challenges with that. And so, our response to that challenge is, okay, so we can work with our local and federal officials to help them understand and be aware of just what the needs are, so that we can better maybe influence how that reimbursement might occur. Another challenge that you may read about, right, which is a shortage of healthcare workers, right? And it's not just healthcare. I would say the labor force in America across industry is fairly tight, but specifically in healthcare. And so one of the things we're doing is to help build and grow the next generation of healthcare workers. So at the hospital, Newton Medical Center, NMC Health, as it's now known. Occasionally, I'll slip back.
Yeah,
right?
Right, same with me. I'll do it the same way.
Yeah, at NMC Health, one of the things we're doing around that, labor shortage, what are you doing? Well, for years, and really ever since I've been here, we invest in the next generation of healthcare worker, not just nurses, but in all elements, whether it's clinical or support. So on any given year, you will find that we have connected with over 350 students. Maybe they're we partner with the Health Sciences Academy at the Newton High School. We have some of our our leaders and clinicians will go out and lecture or teach as part of that program. We have students who are completing their clinical rotations or job shadowing with us, not just at the high school or college level, but post-secondary as well. And again, about 350 individuals are coming through our facility, rubbing shoulders with our staff, our professionals. We view that as our contribution to help grow the next generation of healthcare workers. So even though there's a shortage, we're trying to do what we can to build and grow the next. Yeah.
And that goes back to culture. Investing in your local community is one way to do that. Another one is like what you're saying, have people come and either do, training there or see firsthand from their school, reaching out and making those partnerships, and then the other thing that you'd mentioned, and it is a cliche, culture, right? But that gives you all the opportunity for everybody that comes in the door, both patient, staff, up to your doctors and your surgeons and everything. If they're there and they see the positive culture that you all have, that makes people want to stay, because not all places, I'm sure, are the same, right? So culture is key, and the only way that you can be able to allow people to see your culture is by opening up the door, letting them come in and working there and seeing. Do you feel that when it comes to, you mentioned the human resources aspect, you're the CEO now, but and maybe you still have something to do with hiring and practices and culture and the whole thing. But do you find that helps with retainment? Like people that come in from college, whether it be, I don't know, I think McPherson has a nursing program, right? Does Tabor, I think, has one. Maybe even Heston College has one.
Right.
So these outlying colleges that are in our region, when they come and they experience what NMC Health has to offer from a training perspective, academic perspective, do you find that you become a place they want to be?
That's true. Not every student that we would have where they would choose us for their clinical experiences, but a fair amount do, that they appreciate their experience that they've had with us as a student, and so they pursue us as an employer, and so we're happy to accommodate that. Yeah. So
what helping me understand a little bit about, or the audience understand a little bit about the future of NMC Health. You all are currently doing some things like you had mentioned with the expansion of the emergency department and whatnot. Is there other areas where you all are actively looking at, but maybe just be in the very infancy stages of what you want to be able to offer at NMC Health? Yeah,
and so it's an ongoing question or quest of ours, right? And so we're always asking ourselves, what are the needs in the community, and then what's our part in that? We recognize that we can't solve or address every, but there are some that, you know what, that's in our lane, and we can certainly be a part of that. And so, there's a community health needs assessment that gets conducted collaboratively with the hospital and several other organizations in town, and we identify what are the needs in the community, and then we identify, so what are some of the things we can do? So, historically and even currently, it's identifying, what can we do in terms of prenatal care or care for new moms and their new babes. And so we have programs around that we've helped with. There are a number of others, health education or training programs that we have participated in or collaborated with others towards just in general community better health. Clinically, in terms of, what do we look at? What are we going to expand into, right? So we're always looking at that. So I think one example that would be, we have a strong point in terms of our orthopedic surgery. So in a hallway conversation this week, it was mentioned that, in the last 12 months, we've done over 400 joint replacements, whether knee or hip. And so we have some wonderful orthopedic surgeons. And so it's a great and it's a growing area. I mentioned we brought on another surgeon, Dr. Hutchison, general surgery. We see that as a need, something that we can grow and provide services for. We had a neurologist, and we began to see that the waiting line for his care was getting longer and longer. So we brought on a second neurologist so that we can care for that. It was an evident need, right? There's people waiting to get in. And so we brought on a second one to help meet that demand.
So growing doesn't always mean offering more services, but maybe offering more of the same service to a greater population.
Right, exactly.
And are we seeing that happen in certain areas, like you'd mentioned? You opened up a service of neurology. It got stacked. They couldn't do anymore. You needed to bring on another doctor or general surgeon Hutchinson, as you talked about. Are you finding that maybe that is a little bit more of the path right now, is that there is certain things where you all are being very successful at what you're doing, and so then it's to grow that to be able to serve more needs of people, not so much grow to offer something else
new? Yeah. I think that's a fair statement, Lance. So, another area that we have that I think has been where we have capacity for more, right? So we have our senior behavioral health unit, which used to be called Generations. And it's a great service. And when we opened that, I think shortly after I came in 2006, the idea was, hey, here's a need for folks that may be experiencing some kind of a tilt in their behavior. And so the role of senior behavioral health is to have these folks come in for not a long stay, 1-2 weeks, so we can assess them from a physical and a mental state, and kind of figure out what's going on, get them stabilized or recalibrated so they can return back home or to where they're the area of care that they came from. And so we've always had capacity for that. And so recently we've seen more and more of that. And so we've been able to make most use of the capacity that we have. So it's been there. But just as you said, more of what we're good at. And so as opposed to starting something new and different. However, if we see that there's a need for, here's something new and different for us, but there's a growing need in the community, we may look at that and say, so what's our part in that? Yeah. Maybe we have a part of it, or maybe we can look at a holistic piece of it, but we're always kind of assessing that.
Well, and it's interesting, some of the things that you mentioned, and just most recently the unit that you mentioned, Generations. Is that what it's called now? Or?
Now it's called Senior Behavioral Health, but previously we had referred to it as our Generations unit. Yeah.
And my parents are getting up there in age, if I call it that, but there's a huge, that population is, the baby boomer population is really growing. To that point where that's a big swath of our populace. Mm-hmm. So those needs that you're serving, that population is just going to continue to need that help, right? And then over time, maybe it will move to something else. So there's some flexibility there. Okay, can I get real personal?
Sure.
Okay. I guess I just want to be direct. It's just a burning question I have. Todd, why do you do what you do every day?
That's a good question. And my pause isn't because I don't have an answer. My pause is because I do what I do. I guess out of a sense of purpose, right? We talked about that earlier, maybe before the microphones were on, but it's a sense of calling, if you will, a sense of giving of myself with the skills, talents, and background that I've been fortunate to have in a way that can help others, and in this case, the community, right? So I'm not clinical, but I do know a few things about HR and about administration, so I can bring those to bear. So I'd say that's the reason why.
I threw you on the spot for that, and I apologize.
No worries.
It just kept coming up in my mind, and I just kept thinking, I want to ask you this because, as we have this conversation, I'm just, I'm going back to, once again, we had a brief conversation before the podcast, and in full disclosure, I told Todd, I said, NMC Health saved my life. People that know me know, that know me personally know that there was, a few years back, not that long ago, that I had to have life-saving brain surgery in some freak situation. And I don't remember ever walking in the door to NMC. Somebody else brought me there. You all were the first line for me. And, you guys saved my life. I mean, everything that you did, all the procedures and practices that you had in place, the people that you have working there, the culture that you established, because I was, by all intents and purposes, there. I was talking, I was moving, I was. If somebody was looking at me, they would have thought that I was there, and I wasn't there.
Yeah.
And if I would have been brushed aside, if I would have been, if the culture was there to go, oh, this guy, he must be on drugs, or whatever the case may be. Well, that was right in the nick of time. It really was. And I have an affinity for NMC Health because of that. I was not brushed aside. I was cared for. I take that back to, the cliche of culture. But I wonder if I would have walked into any other place at any other time and them not, and it gets even deeper than this. When I walked in the door, the receptionist knew who I was and said, I know this guy. And I know that he's acting really strange. This is not him. This is not himself. And that person was operating at 100% of their capacity in their duty to be able to recognize that. And we talk about it being a small community. And a lot of the people that work at NMC Health are from the community. You're going to go out and you're going to see them at the grocery store. Your kids are going to play basketball together, football, baseball, whatever the case may be. So I guess, and I want to ask the flip side. I asked you, why you do what you do, what in your heart personally, what has been the biggest challenge that you personally have experienced since endeavoring to do the job that you do over the last 20 years?
That's another good question.
I'm just laying it on you.
You are.
I apologize. It's just, I don't know. I'm really interested. I don't know, Todd. I mean, I don't know why I'm asking.
That's okay. So the question was what?
A personal challenge. I asked you about NMC Health and the challenges faced in rural hospitals, and now I'm asking, what's something that's been a challenge? It doesn't have to be negative, you know. Right. I mean, maybe I don't know. I'm just picking your brain. Is it that you want to provide more care and you can't, or is it what's the biggest challenge?
I guess for me, one of the challenges that come to mind is just being growing as a leader, becoming more, effective, right? And when I say that, it's not necessarily about achieving results or being hard driving, but it's finding that balance of, I guess I would describe it as, to me, a good leader is personified as a coach, right? A good coach, to me anyway, is someone who can draw out of the player more than the player thought they had in them.
Yeah. So
that's a good leader. Another element of a good leader is someone who helps the team member grow and develop and can see the potential, kind of like the coach analogy. And so my personal challenge is that I'm a checklist guy, right? And I love to be able to check things off. And so sometimes that gets in the way. I'm more intent on my actions and to-dos and accomplishments, check. Sometimes that gets in the way of my ability to focus on the person whom I'm helping to grow or develop, or even to provide the conversation that may be difficult or awkward because it's a bit confrontational. However, any good coach would have that conversation to bring the player, make the player aware of, here's this blind spot that you have. And it's not fair of me not to bring it up to you because you'll never get a chance to improve or grow from it, right? So that's a hard part. And so those are some challenges that I have, is being comfortable or confident to have those conversations that would help someone, even though it may be challenging to have, although they're meaningful and helpful. Anyway,
yeah,
I'm
you answered it. You answered it for me. I mean, I'm listening. I'm understanding what you're saying. So, yeah, and I think clearly the audience would too, especially anybody that's been a coach, anybody that's been a parent. I mean, I hate to liken it to that, but I just, in my mind's eye, kept thinking, not all the conversations that I've had with people that I love dearly in my life that I want to see truly succeed in every way, shape, or form, and I have nothing but the best for them, is always a fluffy conversation, right. And you have to be very tactful and very considerate in who that person is and their personality, and you're dealing with all sorts of personalities, all sorts of worldviews, all different backgrounds, right. All different educations from top to bottom. So okay. So if whoever's listening to this right now, listening to our conversation, if you were going to look at them and say why they should choose NMC Health, why should someone choose NMC Health for their job? Mm-hmm. For the place that they choose to go to get care, and you want to cover it a little bit, but just more directly, why choose NMC Health?
Yeah. So from an employment standpoint, why choose us to work as a place to work? I'll just echo what some of our recent new hires have said, really over the past couple of years. We have a culture, not perfect, but it is one that is supportive, where we seek to help people to grow, where we embrace the sense of folks having a sense of calling that they want to live out. We're a great place to do that. And in terms of care, I just say that our history and our experience, maybe as we hear from others, speaks clearly about the difference that one could experience in terms of care with us. So that would be what I would say, some differentiators.
Yeah. Okay. Well, I only have one more question for you. We can cover anything else you want to cover or anything that I didn't ask. Feel free, right? Because I think our conversation could go on forever, to be completely honest with you. But the last question that I have, and it's the question that I always ask everybody, Todd, is if you had a chance, and you do, to speak directly to the hearts and the minds of anybody listening, it doesn't have to be about anything we talked about. It could be something personal. Just leave the audience with a nugget. Here's your chance to speak to them. What do you got? One thing that comes to mind is, our mission statement is to excel in providing health care by understanding and responding to the individual needs of those we serve. Twice a week, our leadership team meets in the morning for about an hour, and we touch base on operational elements as well as some leadership elements as well. But we always start the meeting by reciting our mission. And so it is a reminder and a refresher for us as to why we're here. And so the mission speaks, I think, loudly and clearly, and reflects, I think, the heartbeat of certainly the leadership team, and I think many of the team members that we have. Thank you, Todd.
You bet.
Thank you. All right, everybody. Thank you for listening to this episode of HC Talk. As always, I was your host, Lance Gormley, and our guest on the program today is Todd Tangeman, who is COO of NMC Health, has been there 20 years, and is still just doing a great job for us and our community and NMC Health and everything there is. I can be absolutely 100% about that, Todd, because I appreciate you.
All right. Thanks so much. Glad to be here.